Hello, Derek. I'm Rebecca. How are you doing today?
Good.
Okay. First of all, I want to ask you, do you have any history of any skin diseases? Okay. I'm going to be looking at your hair, your skin, your nail beds, okay? And I just want to talk to you about a couple things while we're doing that, okay? You have a few moles, I see, and that is normal. It's normal for anyone to have between 10 to 40 moles, okay? There's the ABCDs of melanoma, we want you to remember, okay? A is for asymmetrical. We want to make sure that your moles are not asymmetrical. We want to make sure that there's borders, okay? We want to look at the colors. Now, yours are all looking normal. They're flesh toned or brown. If they get black or blue, we want to make sure that, we get those looked at. And D, we want to look at the depth of them, okay? We want to make sure that they're about the size of a eraser on a pencil, okay? Less than 5 millimeters, okay? So I'm just going to look at everything here. We'll start here and look. Like I said, you have quite a few moles, but I believe that they all look nice to me, pretty good. No dark ones. Get this over. Now you have one right here, but it's, like I said, it's brown, and it's smooth, and it's oval, okay? And it's well defined, okay? Well, I'm going to look at your legs. And look at this leg right here, okay? I'm going to feel for some blood flow. Okay, we have good blood flow there. We have good blood flow there. And look at this foot. That feels good. Okay. Now, I'm going to look at your hair. And you do have a mole there. Again, it looks normal color. Okay. Now I'm going to look at your nail beds, okay? Good blood return. They're nice and even. Do your fingers ever get cold or blue? Okay. You want to make sure that they don't, okay? You can just press on your nail beds, make sure that there's, do you see how when I press down that comes back, the blood comes back? There's good blood return, okay? Now, I'm going to look at your nail beds. I'm going to measure them. And they're less than 160-degree angle, so that's good. We want to make sure there's no clubbing there, okay? Now I'm going to look at your toes. Do your feet get cold sometimes? Okay. That's something you might want to tell your family doctor, and I'll make sure to tell them when we're here, but we do have good blood flow there. Okay, so again, because you are fair-skinned, do you get out in the sun much? Okay, I want you to use a good SPF at least 40 of sunscreen, okay? Okay, let me feel for blood flow here. Good. Feel for it here. Okay, that's good. Appreciate it.
Welcome.
Now we're going to be looking at a few things on your skull and your head and your face. Okay? Okay. Got a nice round head. Has anybody ever told you that before? Okay. Okay. Now that you're smiling, I want you to clench your teeth. Good. Now, can you frown for me? Good. Okay. Now, can you swallow? Does that hurt? No. Okay. I've got some water right here, if you will. I want you to take a sip and hold it in your mouth, and then I want you to look up. Now, swallow that for me. Good. Did that go down okay? Any tenderness? Okay. Now, I want you to look at me straight. Okay. Now, can you look side to side? Okay. Can you turn your neck and tilt your head side to side? Okay. Does that hurt? Is there any straining there or anything? No? Okay. 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 Now, I'm just going to feel your lymph nodes. Okay. There's several to feel, so I don't mean to push too hard. Are they sore anywhere? No? Okay. One more time, just want to make sure. Can you just swallow for me there? Okay. Now, I want you to extend your neck up. Okay. I'm just going to check your trachea here. That sore there? Okay, now look straight ahead. Okay, now, how about here? Any soreness here? Okay, I just want to listen. Good. Can you hear good blood flow? I'll listen to the other side. Okay. You ever get any lightheaded or dizziness? Okay, good. All right. Okay. Everything looks good, so you don't have any soreness when you turn your head from, okay? Can you hyperextend just one more time? And let me just look at that one more time. Measure your rings. Sore there? Okay. Okay, Derek, everything looks really good. You look like a nice, healthy young man. Okay, Derek. Now what we're going to do now is for the confrontation test, okay? I want you to cover your right eye with your card, and I'm going to cover my left eye. And then when you see my hand coming in with the gesture, I want you to tell me immediately when you see it, okay? So go ahead and cover your eye, okay?
Yes.
Okay.
Yes.
Okay.
Yeah.
Okay. Now, let's do the opposite eye, okay?
Yes.
Okay.
Yes.
Okay.
Yes.
Good. Okay. Now. All right. Now, I'm just going to check a few other things with your eyes, okay, while we're doing this. Okay. I'm going to look at your, let's take a look at your eyeballs here, at your eyebrows. Be sore, tender?
No.
You have any discharge coming out of your eyes?
Mm-mm.
Okay, look up. Okay, now look down. Okay. 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 Now look at your glands here. Okay. Any pain?
No.
Okay. Do you need to put your glasses back on?
Mm-mm.
No? Okay. All right. Now what I want to do is I'm going to look at your pupils, okay? Good. Constriction. I would say your pupils are about 4 millimeters. That eye too. Okay, and I want you to look straight across to me. Okay. Now, I'm going to check your corneal reflex, okay? Okay, good. Okay, I think that's good. Now what we're going to do now is we're going to check your vision, okay? How long have you wore glasses?
All my life.
Okay, your cranial nerve 2 is your optic nerve, and that's the one that we're going to be measuring right now, okay? So if you don't mind, we're going to check this called the Snellen chart. We're going to check it with your glasses on and with your glasses off, okay? I'm going to do one eye at a time, and you are 20 feet away, okay? All right, so at first, if you will take your card and you will cover your right eye up. Okay, now, on this chart, which is the first line that you can read?
7.
Line 7. Okay. Can you please tell me the letters?
F-E-L-O-P-Z-D.
Good. Now, can you go backwards with them?
D-Z-P-O-L-E-F.
Good. Okay. Now, can you cover your other eye? Okay. Now, that your left eye is covered, which line can you see? What's the first line that you can see clearly?
8.
Number 8. Okay. Can you please tell me that?
D-E-F-P-O-T-E-C.
Okay. Now, can you go backwards, please?
C-E-T-O-P-F-E-D.
Okay. Good. So what I want to tell you is, Derek, with your right eye, you have 20/25 vision, and with your left eye, you have 20/20 vision, okay? That's with your glasses on. Now, if you don't care to take your glasses off for me, you're going to repeat the same thing, okay? Now, you can go ahead and cover your right eye. Okay. Now, without your glasses and your right eye covered, which is the first line that you can see clearly?
3.
Line 3. Okay, could you please read those to me?
T-O-Z.
Good. Can you read them backwards?
Z-O-T.
Good. Okay, now can you change the card and cover up your left eye? Now, which line can you see clearly?
5.
5. Okay, could you please tell me these letters?
P-E-C-F-D.
Okay.
D-F-C-E-P.
Okay. Okay, go ahead and put your glasses back on. Okay, so clearly we can see a change here from where you don't wear your glasses and when you do. With your right eye, you are seeing at a 20/70 with your glasses off, okay? And then with your left eye, you are seeing at a 20/40, okay? So we definitely see a difference between the right and the left eye. And we definitely see a difference in between wearing our glasses and not wearing glasses. So I would say you need to wear them all the time. Okay. Okay. All right, Derek. Now I'm going to look at your ears, okay? I'm going to start with, you have 2. That's great. Okay. Just going to look at them, the folds of them here, the color of them, the shape. They feel good. No nodules. No bumps. Are they tender?
Mm-hmm.
They look symmetrical to me. Okay, we'll look at your trays here. Okay. Now I'm going to look in your ear canal. I see the fine cilia. I don't see any discharge. I see your tympanic membrane. It's nice and gray and pearly. So look at this side. Good. I don't really see any buildup of wax. I can see the tympanic membrane on this side too. Nice and pearly and gray. Okay. Are you having any earaches or any discharge or anything?
No.
Okay, you know not to stick cotton tips in your ears, don't you? Okay. You hear pretty good?
Yes.
Okay. Okay, let's see. Now I'm going to do, it's called a whispered test, okay? I'm going to stand behind you and I want you to tell me if you can hear what I say. just say, Derek?
I am tired.
Good. Now I'm going to go to this side. What did I say, Derek?
I am in nursing school.
Good, good, good. All right, now we're going to do the Weber test, okay? It's where I'm going to take this tuning fork, okay? And when you can hear the vibration ending, when it starts, you can hear it from the start and then tell me when it ends, okay? Can you hear that?
Mm-hmm.
Tell me when it stops.
Okay.
Okay. Now I'm going to do the Rita test, okay? Tell me when that stops.
Okay.
Good. We want to make sure that that one is twice as long as the top one, okay? Okay. So I want to make sure you don't put anything like cotton tips in your ears or anything like that. If you get any discharges, make sure to tell your doctor, okay? Do you have any questions?
Mm-hmm.
Okay, thank you. Okay, Derek, I'm going to look at your uvula. Look up. Stick your tongue down for me. Go down with me. Okay. Now, smile for me. Got all your teeth?
Hmm.
Got nice teeth. Did you wear braces?
Yeah.
Well, they paid off. Very nice teeth. Is any of this sore? Is your gum sore?
Mm-mm.
Do you floss?
No.
You need to floss. That's more important than brushing. Did you know that?
No.
It's true. If I only had one thing to tell you between flossing and brushing, you need to floss. That's most important is flossing, okay? Okay, let's see your tongue one more time. Look up. Good. Your teeth looks good. Yeah, your teeth are really tight together. This is true. Your teeth are really tight together, and you wouldn't believe how much food particles get in between your teeth, which causes bacteria, which can cause strep throat and things like that, and give you respiratory infections. Very important to floss, 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 floss. Like again, like if you brush too much, you'll brush the enamel off your teeth. Brushing is not near as important as flossing, and your teeth are really tight together where you've had them braces. So it's very important that even if you don't like to do dental floss, do the little those little pickers, you know, and floss in between there because you wouldn't believe the bacteria stuff that gets in there in between your teeth, and you should floss between every meal. It's real important, okay? Derek, we're almost done with our exam, okay? Now we're just going to, the final part of our exam is we're going to look at your nose, your mouth, and your throat, okay?
Okay.
Okay. Look at your nose. Your nose ever been broken?
Mm-mm.
Okay, good. Now what I want to do is I'm going to cover your left nostril up with my finger, okay, and I want you to breathe in and breathe out. Again, in and out. Okay, now I'm going to do the reverse on this side. In and out. In and out. Are you having a hard time breathing?
Mm-hmm.
Okay. All right. Now, I'm going to look up in here. Okay. Looks good. I don't see any polyps. Okay. See your septum. It looks good. Okay. Okay. Look at you again. So, do you have any sinus problems?
Mm-mm.
Does this ever get puffy or tender?
No.
Okay. If it does, you can get you some hot, warm comb presses, comb presses. Put them on your sinuses, and that'll bring down the inflammation. Okay. Okay. Now, I want to look at your mouth. Okay. First thing I'm going to do is I'm going to get me a tongue blade. Okay. Now, what I want you to do is, do you have tonsils, Derek?
No.
Okay. Stick out your tongue for me real far. Look back. We'll check your gag reflex. Alright, good. Now I'm going to look in your throat. Okay. Now, I want you to raise your tongue. Raise your tongue up for me. Good. Letting out your Wharton's duct. Okay. Okay. Now, can you stick your tongue out again for me? I'm going to move it to the side. Okay. To the other side. All the way out for me, Betty. There we go. Okay. Now, tell you what I want to do. Just one more. Look all the way up. Gotta look at the roof. Good. Now stick your tongue all the way up. Good. Alright, good. Okay. Now, at this time, can you put your head down? Tilt it down all the way down? Good. Now look all the way back. Good. Feel your trachea there. Okay. Your gag reflex is intact. I don't see any nodules or anything out of the ordinary. Do you have any question? You don't smoke or chew snuff, do you? Okay, good. Well, this has been a good exam, and I appreciate your time. Thank you.